LI5, where exactly the point is located? Now LI1, 2, 3, 4, 5. 5 you find the snuff box. The snuff box means this is a snuff box. Now how to do that? You can find thumb upward direction. When you do like this, you can find there is a snuff box here. This called as a snuff box. So there are the two tendons, are extensor pollicis longus and extensor pollicis brevis. This tendon to be known as this is the thumb side, the tendon to be known as a extensor pollicis brevis, and this tendon to be known as a extensor pollicis longus tendon. So here there is a point to be known as a LI5. Now we just try to find out. If you wanted to know where exactly this point is located, you just place like this. Good. Is it hurting for you, the needles? We have to find out still. See, now you can feel. I'll put the few drops of the spirit. Right. This my hollow is there. I just put the few drops of the. It's not moving. Once I place 1 or 2 drops of the water, so that means that is stuck or stayed on the snuff box. So that area to be known as a yang C. That area to be known as a yang C. I just place it here. Is the 1-2 drops. Then water is not moving on the other side. So that particular area to be known as a yang C. Right, you also, all of you locate where precisely that location. Right. So now what exactly the beauty of this particular point? In fact, this point to be known as a command point. This point to be known as a command point, which already I told you, LI1 is the horary point, LI2 is the sun point, LI3 is the grandson point, now LI4 is the source point, LI5 is the command point, grandmother point. That means grandmother point. पानी दिया उनको एक ग्लास में. It receives the energy. Grandmother point. Remember, the mother point and grandmother point, it receives the chi from the other organ. It receives the chi from the other organ. So therefore, the grandmother point is it receiving the energy from the small intestine. When there is the problem in the large intestine, where the energy is not coming from the small intestine, that particular time the chi is moving to the small intestine, large intestine. That's called as a SI5 yang C. This belongs to the fire point. This belongs to the fire point. Anything the fire get excessiveness in the small intestine or the large intestine, to reduce, to regulate, to minimize the chi to be taken place by activating this particular point. So therefore LI5 is the very wonderful point to treat for the colon related disorders, especially the large colon and small colon. When the metabolism is not good and then the bowel movements are not good, that particular time certainly we can activate the LI5 point. At the same time, LI5 is the fire point indicating the person who is suffering for the hemorrhoids, stools, bleeding or the burning sensation, indicating there is excessive hot in the colon. Due to that reason the patient feel hotness and flushes, especially while passing the stool. Before he passes the stool or after he passes the stool, when the patient is complaining, I do have the burning sensation, indicating the colon fire is excessiveness. To reduce the colon fire, we just use the LI5 point sedation to be taken place. So how to be done that procedure? Be careful. So now slightly uplift your thumb, that's called as a abduction of the thumb, and then try to press and then feel. Press and then feel. Once you lift this thumb and then press and feel the hollow depression. So you come down from the thumb, you come down. This is the transverse wrist crease, and then where exactly there is a depression, in this depression I just sedated this to be sedated, that means sedation. So this is the grandmother point, but towards the energy flow to be activated. But same point I need to sedate the grandmother point, but I just applied the anti-direction of the energy flow. That means is the opposite direction of the energy flow. I sedated the large intestine meridian heat especially, so that means is the small intestine heat and then large intestine heat to be regulated by activating this point. So therefore the hemorrhoid is there that particular time certainly. If the patient is mild to moderate, if you have the problem, so certainly you can use this point. When the patient is having the CA of the colon or the malignant in the colon, cancer in the colon, so that particular time also causes the bleeding and then burning sensation that time. So we try to find out what exactly the etiology to cause the problem, but of course as a supplementary of the acupuncture to be done for that conditions, no, you can apply this needle, the patient will be all right. So there are the several stages of the diseases, the preliminary or the rudimentary stage or the classical stage or advanced stage is there. That particular time the acupuncture doesn't work to that root level. Of course that time the another modality or the other super specialization treatment or that knots are there to dissolve that knot or doing the binding to that knots to dispose that, anything to be done in that way. So of course doing the small amount of the surgery also recommended when there is the colon having the bleeding or some kind of the cancer is there. Of course without that definitely the patient, due to the pressure, what happened normally due to the competitive lifestyle, we are in hurry to rush to the jobs and then places. That particular time we wanted to pause the stool precisely, but some people says when I sit only one particular place I get the relaxation. That relaxation place is restroom, aram se baitho, without anybody's disturbances. Person take the phone inside, patient take the book inside, novel book, story book or the newspaper or WhatsApp university. So many universities they will be involved to watching inside the washroom because it doesn't come on time. It takes the longer time. So that's the reason he don't want to waste the time. That particular time he chat, sometimes he talk to his fancy also, sitting in the restroom. Right, that's what is happened sometimes. If thought process is somewhere, how the evacuation to be done, how the defecation to be taken place, that will not happen. But however, in that particular situation when we wanted to use the colon to come out the stool, so that particular time you are giving the lubrication by using the yang. C is the river point. So the first point is the well point, the second point is the spring point, the third point is the sanjiant, is the stream point, whereas in the LI4 is the good point, LI5 is the river point. LI1 is the well point, LI2 is the ing spring point, or we called as a effusionary point. LI3 is the LI3 is the inductory point or the stream point. Shu means is the stream. The shu stream points are always is good for the pain management. The patient is suffering for the shoulder pain. That time LI3 is the wonderful point to treat for the shoulder brachial syndrome. Then the LI5 is the good point to treat for the river conditions. That means anything the pathological obstructions in the colon. There is a stagnation is there, that's not moving. I told you from the well the energy moves to the spring, from the spring the energy moves to the stream, from the stream the energy moves to the river. From the river the energy moves to the sea level, right? So river also very big rivers, right? So from one state to other state it moves in this way. So anything there is obstruction in that meridian or obstruction in that particular organ, to free flow of the chi to be taken place by activating river points are always is good. At the same time the river points also good for the treating for the sinews, bones and then tendons. Tendons, bones and cartilages related problem can be treatable by activating the Qing river points. Qing is the well, Qing is the river. Both are writing is the same, but the pronunciations are different in the Chinese calibration. But however, the Qing river points are treatable for the all the musculoskeletal disorders as well. Now the musculoskeletal means is the wrist arthritis or the wrist arthritis or the wrist pain, or we called as the radial nerve related problem, elbow related and shoulder related problem also can be treatable by activating the LI5 point. Where exactly? On the snuff box.